Hello everyone, my name is Irene Ishen and my project work is about opioid-induced constipation, and I chose to develop a checklist to educate patients who are on long-term opioids. So my learning objectives were to review 8 articles related to the topic at hand, which is opioid-induced constipation, locate existing guidelines on preventing opioid-induced constipation, prepare a lesson plan for the nurses on the topic at hand, prepare an education checklist, and introduce the education checklist to the staff, the nurses on the unit. On the slide, we talk about opioid-induced constipation. So opioid medications are prescribed to relieve severe to moderate pain. And like any other medication, they come with side effects or adverse effects. And these adverse effects include nausea, vomiting, abdominal cramps, and constipation. And constipation happens to be the main focus of this project. So when we talk about opioid-induced constipation, it refers to any constipation as a result of opioid use. And with that, it can be a gradual onset or immediate onset. And some people already have a history of constipation, and when they start taking opioid, it worsens that. And it accounts for like 50 to 80% of patients receiving opioid for pain control. That is why sometimes some physicians prescribe laxative or stool softeners as soon or together with opioid medications. So with the mechanism of action for the opioid medications, it inhibits gastric emptying and decreases peristalsis in the GI, and that leads to impacting of feces and delay of food that moves through the GI, leading to constipation. For risk factors of constipation, anybody who takes opioids is at risk of developing opioid-induced constipation, and it's irrespective of age or gender or anything. Everybody taking opioids is at risk of developing opioid-induced constipation. For our complications of opioid-induced constipation, we have mini strokes, perforated rectum, and mood disorders. The mini stroke is because of strain trying to pass. People just get mini strokes, or when they are trying to strain and pass hard feces and they getting a perforation in your rectum, or a tore in your rectum can spill feces into the abdomen, which can lead to sepsis. And mood disorders, like the person has changes in the mood. So the main purpose of my project work is to develop an education checklist to educate patients on long-term opioid, just to prevent or just minimize the effect of constipation. So a total of 8 literature reviews was done on the topic. The articles I review show the pathophysiology of opioid-induced constipation, indicating that the binding the reserpine to the receptor in the GI tract, which leads to slow peristaltic activity, decreased mucosa secretion, and reduced bowel tone, leading to difficulty evacuating stools. Patients who are receiving opioid medications are supposed to be prescribed laxative at the same time when they start the opioid medication to help move their bowels. I also discovered that lifestyle changes alone does not treat opioid-induced constipation. So lifestyle changes like adding fiber and drinking water does not treat or help with it helps with opioid-induced constipation, but it doesn't treat it. So we need to focus more on like effective treatment, like the food and drugs or medications they prescribe. And it's also essential like to talk to your physician on something they call like what they call it, opioid rotation. So with the opioid rotation, they give you we have the lipophilic opioids and the hydrophilic opioids. So the hydrophilic opioids have less effect on the GI tract. So they just balance between the hydrophilic opioids and the lipophilic opioids. So all the 8 articles recommend lifestyle changes like physical activity, eating adequate fiber 25 to 30 grams per day, drinking a minimum of 8 to 10 cups of water a day, and they also recommend the use of laxative. But out of the 8 articles I reviewed, only 3 of them endorse the opioid rotation, and the reason being that it's very difficult to manage a client's pain with that, because you have to trend down the patient you have to trend down one opioid, or you have to increase the dose of the other opioid to achieve adequate pain relief. And the patient, it takes a while for that to be trended. So only 3 articles endorsed the use of opioid rotation. So an education plan for the nurses and education checklist for the patients was developed based on the recommendation from the evidence-based articles and the guidelines I reviewed. The educational material for the nurses focused mainly on the pathophysiology of opioid-induced constipations, at-risk patients, and prevention. The education checklist for the patient focused on things how to prevent opioid-induced constipation, like lifestyle changes, exercises, and adding supplemental fiber to your diet, and the use of laxative. So the education material focused on lifestyle changes by adding supplement to the diet, like drinking a minimum of 8 to 10 cups of water a day, performing physical activities like yoga, deep squatting, running, skipping, walking. Doing all these increases blood flow to the intestines, and this creates strong contractions through the digestive tract and helps lower the time it takes food to move through the large intestines over the large intestine. And they also recommend, I also added over-the-counter remedies like fiber supplement, metamucil, and it add bulk to the stool, and stool softeners like Colis, and so for moisturize the stool by drawing water into the bowel. So I also developed a 5-question post-test for the nurses to assess their knowledge. And the main outcome I set for this was the participants will be able to implement the outcome for this lesson and education checklist was the nurses or the participants will be able to implement the education checklist with minimal help, and afterwards they will be able to answer the post-test with a 95% or higher score. After developing my education for the nurses and the education checklist for the patient, it was time for me to implement it. So initially I was going to do like hold a one class and educate everybody at once, like all the nurses at once, on the opioid induced constipation and how to prevent it, and introduce them to the checklist. But I found out that it was going to be very difficult for me to do it because we have a very busy unit and they do not even have a little bit of time to spare. So what my mentor and I decided to do was do a one-on-one training. So I was on the unit for a while And anybody who has a spare time, I sit with the person, I educate the person on the opioid induced constipation. Then I just give her the checklist. We go through the checklist on how to educate the patient on that. Afterwards, I observe her to give an education on her patient with opioids. Then afterwards, I give her the posters to take the posters. So each nurse on the unit was educated individually on a topic, and this provided them the chance to ask questions and also verify some of the information I had on my checklist. After the education, the patient's checklist was also introduced to them, and I helped them navigate it for the first time. Afterwards, we also did the post test, the 5 questionnaire post test, and I provided them with the result, and we reviewed the test together. So the questions they had wrong, we went over it, and it was just like nobody just, oh, okay, I didn't know about this, even though she read it. So we just review, and I gave them feedback. We went over the questionnaires again, then we moved on. So in total, I spent a 48-hour on this project work. I was able to develop and implement the education checklist for opioid-induced constipation successfully. Both outcomes I set was met, and it was evident that the nurses were able to implement the checklist with minimal help, and all the nurses who took the post that had a 95 score or higher. But one key thing I stuck with me was uh, I learned that once opioid-induced constipation develops, it's very difficult for you to return to normal bowel function. That is why it's very essential to educate the patient on how to prevent it. Thank you. And these are the references I use for my project work. You are free to verify them. Thank you.